There is a mastery of body of knowledge. There are specific duties that I have to do. Profession is self-governed. Profession is self-regulated. Profession provides service to the community. ولازم فيها ما يدير لها regulation. What's the regulation? Integrity. النزاهة. كان الرسول عليه الصلاة والسلام الصادق الأمين. That's what integrity. أن تكون صادقا وأمينا على المرضى. I need nothing from you more than that. So, honesty, truthfulness, accuracy of one action. Lack of multidisciplinary input. It is safety. We measure it in our hospital in our way by infection rate, anastomotic leak, and mortality. No, that's not only. Was the surgery indicated for this? Was the surgery is what's done ethical? Did the patient understand the realistic outcome? مش إن شاء الله نحولها وأمورها تمام ومفيش مشكلة حميدة. Surgery. The practice of surgery is based on surgeon technical capability, knowledge, and capacity of judgment. That's what ethics. تفسرها كيف ما تبدي. So it is about zebra. Is it white striped with black or black striped with white? تقدر تقنعني لبكره نقدر نتناقشوا فيها ونتخاصموا. So ethics فيها اللعبة في الكلام.
I am Professor Abu Ajel of this. I am a consultant, medical consultant for Exir company, which is a drug importing and distributing company. One of our branches is we are interested today in oncology. There is a company, new company. It's not new. It's new in our country here, but it is a Russian company situated in Moscow. It is the first company in oncology and rare diseases and some autoimmune diseases. It is there is some biosimilars and generic drugs in all different types of solid and hematology cancers. Mainly you can say melanoma and Hodgkin and non-Hodgkin lymphoma, renal carcinoma, and so on. There is also other diseases for systemic sclerosis and ankylosing spondylitis and neutropenia, leukemia, and so on. You get about 40 different drugs related to this field.
I can ask you maybe about the demand in Libya for these drugs.
The demands are yes, you know, nowadays all the worldwide are in need for such drugs differently according to the such diseases. There are some very common and some rare diseases. You know, it's a variety. Here what we are aiming for, actually we are competing. In Russia it is the first, nowadays it is the first company, industry company in oncology department diseases for then Russia, it was competing Roche company. Nowadays we are trying to introduce it here to our country to do such a competition, which is badly needed in our country if we want to nationalize such a treatment in our country. Yes, because especially the biosimilar drugs, which is less price and economically and also from the other point, clinical applications of such a disease and less side effects and effective drug as quality control.
I would like to thank everyone for the opportunity to be with my dear colleagues from الهيئة الوطنية لمكافحة السرطان بدولة ليبيا It's really a pleasure to be with you, and hopefully next time to be in person. Due to previous commitments, unfortunately, I'm not being able to be in person, and I'm just on the kind of a virtual talk. I graduated back in the year 2004 with the top 5% of the class of the Qasr Aini Medical School. And on the right side, this is my colleague, Professor Ahmed Magdi, and we are sharing the same avenue in the field of oncology till today. So actually, as well, I was lucky to have been mentored from the beginning with Professor Muhammad Abdullah, Professor of Clinical Oncology and the head.
Hussein Badr. I work for Hikma Pharmaceuticals as a product manager for the oncology line in Egypt, and we're here today in Libya just to spread the awareness about Hikma and in the conference. So first of all, I would like to say that Hikma is very seeing Libya as a very promising market, and actually the authorities here are taking very good steps in the proper screening and diagnosis of cancer patients. And actually we did this in Egypt at the beginning, so we have like the experience in Egypt, and we see that Libya is taking very good steps in this path. So we came here to just because we want to be part of this. We want to help the patients, we want to help the authorities in their mission towards treating cancer patients. As you know that the brand promise of Hikma is to put better health within reach every day. So it's a very good opportunity for us to participate in this mission for Hikma. This is our first presence in Libya, and we're just starting the promotion. But of course, we're planning to visit several cancer centers and several doctors just to check what they need and what are the current challenges for them in the treating of cancer patients. And of course, we're going to provide them with whatever they need from our portfolio, which is very high quality generics for the oncology.